Hi, my global hepatitis alliance friends. Good morning, good evening, good afternoon, wherever you are. And I'm so proud that this is our second World Hepatitis Testing Week. This marks the beginning of it. So my name is Dee Lee, the president-elect for the next year for the alliance. And thank you so much for, electing me to become the probably most vocal person in the hepatitis sector, but also get my most important journey started. So without further ado, just wanted to kick off this meeting. Some housekeeping rule I wanted to roll out in the very beginning is that it is being simultaneously translated into Spanish and French, and the instruction will be shown on the screen. It's easy, just click, have some clicks, no more hustle. If you wanted to ask, how I'm going to do it, drop your question in the question box, the chat box as well. And you may ask why there is no, Chinese, Hindi, Russian. Bear in mind, maybe we will try some, in the very near future. We are not going to leave anyone behind, but please bear with us now. It's English, Spanish and French at the moment. So this webinar marks the start of the second World Hepatitis Testing Week, which begins on this month, which is today. What we're going to do for such important day is the World Hepatitis Testing Week is a global campaign by the World Hepatitis Alliance, highlighting the urgent challenge facing us, the need to dramatically increase the testing and diagnosis viral hepatitis if we were to reach the elimination targets by 2030. I'm now in Manila. Guess the testing rate for the general population of people living with hepatitis. It's only 11%. And that really leads to 2% of the population, of this group of the population, people living with hepatitis, introduced to the treatment. So during the World Hepatitis Testing Week, we urge everyone to get tested for hepatitis and to push for more hepatitis testing in your area. So it is an opportunity today to explore the approaches to scale up access to testing through the innovative approaches. So we're going to have 3 exciting fireside chats. When I say fireside chat, it doesn't really mean we have the intense. It can be very intense, but it's more importantly, no more education, no more doctoring. It's all about sharing information and try to mingle yours with us, with the speakers, to see what is the best way to get our testing done in different places. This also we're going to talk about the critical, why it is critical to integrate the hepatitis testing into the cancer and mental health programs and scale up the access to testing in prisons, reach people at risk of living with hepatitis and meet elimination goals. So by really introduce our fabulous speakers for the fireside chat, it's all my privilege to introduce the video, let's say, I think the endorsement or maybe the compliment from the Dr. Tereza, from the WHO. So she is the director of the Department on HIV/AIDS, tuberculosis, hepatitis, and STI. With her saying, it's more important for anyone else in the sector to say something. What is the next step for globally? So may I introduce the video of Tereza Kasaeva to talk about what does she think of the testing week? Thank you.
Dear colleagues, on behalf of the World Health Organization, I am honored to join this important webinar hosted by the World Hepatitis Alliance to mark World Hepatitis Testing Week 2025. This week highlights the critical role of testing as the gateway to prevention, care, and treatment, and ultimately to the elimination of viral hepatitis as a public health problem by 2030. The last global hepatitis report underscores the urgency of our mission. Viral hepatitis is one of the leading infectious causes of death globally, claiming 1.3 million lives each year. These are preventable deaths. In 2022, an estimated 304 million people were living with a chronic hepatitis B or C infection. Alarmingly, nearly 87% of those with hepatitis B and 64% of those with hepatitis C remain undiagnosed despite the availability of diagnostic tests and other tools. By scaling up testing, treatment, and prevention, and achieving the global 2030 targets, we can prevent over 9 million new infections and save more than 2.7 million lives, most from liver cancer and advanced liver disease. WHO is currently working with the member states and partners to prepare the 2026 Global Hepatitis Report, which will reassess the global response and provide updated epidemiological and burden estimates. The report is scheduled for release in early 2026. World Hepatitis Testing Week should serve as a catalyst for renewed commitment. We applaud the tireless advocacy and community engagement of World Hepatitis Alliance and civil society partners that amplify the voices of those most affected and who form the backbone of the response. Let us seize the momentum to accelerate commitments, mobilize resources, and make hepatitis elimination a reality. WHO remains steadfast in its commitment to support countries, partners, and communities in finding innovative approaches, not only for testing hepatitis B, C, and D, but also for treatment, care, and service delivery, ensuring that no one is left behind. I wish you a successful webinar. Thank you.
Thank you so much, Dr. Tereza. And yeah, sorry, I keep shutting out my camera. Thank you so much, Dr. Tereza, for making this rather important message, and then as well as your let's say the wishful, your very good wish for on the hepatitis sector. I can see that I'm totally thrilled to see what's going on with the newly report in the early 2026, and also I can't agree more with one of your saying that it's a catalyst for the to urge for more commitment. We keep saying that our civil society, we don't have anything on our hand to encourage to engage with the policymaker. I can only see now loud voice always come with data. So with these data, I don't think we can, should, beg for the, a policymaker, because this is always a weapon or sometimes the carrot to really make the policymaker to move forward with the policy and translate the commitment into action as well. So without further ado, I'm totally thrilled for the new upcoming report and the saying from the Dr. Tereza. But the more importantly now, I would really want everyone to jump into our fireside chat. So the first one would be the it's going to be shared by my dear buddy Shaibu Isa, the director of the Tanzania Health Alliance, and also the board member from Africa region, and also my dearest Alexandra, Smith. So she's the advocacy and engagement manager for the Alliance. So please unmute yourself together with me to join this lovely, fireside chat. So can you introduce yourself a little bit within 1 minute? Shaibu, okay. Can you go first?
Yeah, hello everyone. This is Shaibu Isa. I'm from Tanzania. I'm a global hepatitis advocate, but I'm also founder and director of Tanzania Health Alliance, THA. And currently, I serve as a board member Africa for the World Hepatitis Alliance. Thank you very much.
Hi, everyone. I'm Alexandra Smith. I'm the Advocacy and Engagement Manager at WHA, and I lead a lot of our liver cancer advocacy. So really pleased to be here today, and thank you so much for joining.
And Alex mentioned that this is her first public speaking for the Alliance, and I don't see that would be the very first time. You are doing a very good job at the moment.
Thank you.
Can I have the question for both of you? That it's my very burning question for the testing. Why hepatitis testing important for cancer prevention? This is a fireside chat. Just snatch the microphone, please.
You go ahead, Shaibu.
Yeah. Okay. This testing week is very important because hepatitis testing it can prevent also cancer. As you know, as hepatitis B and C are leading cause of liver cancer worldwide. So most people living with chronic hepatitis B and C, they don't know their status, so they miss the chance for early treatment that can stop liver cancer from even developing. So when we test early, we prevent cirrhosis, we prevent liver failure, and most importantly, we prevent liver cancer. So testing is the first and most cost-effective step to saving life. Many people living with chronic hepatitis B and C are not in diagnosis and are not in treatment. This is according to the report from WHO to the more than 177 countries that many people are not in treatment. So hepatitis can be prevented and can be prevented. For instance, hepatitis B, we can prevent it by vaccine, which is effective vaccine, 99 efficacy. But the problem is that many people are not aware. So the first, most important step to make sure that people are aware is to testing them. Many people are developing liver cancer and cirrhosis at late stage because many people still looking healthier while they have the virus. So testing is very important also in issue of the cost of treatment. You know, hepatitis treatment is very costly, especially in Africa, from diagnosis to the treatment, medicine, and everything. So the best way to save this cost is to test people earlier, to vaccinate, and to manage people who are positive, but also to hepatitis C. Hepatitis C can be cured within 12 weeks. We call it sustained biological response. But even if with a cure, but if people are not aware, people can't find it for the things they don't know. And that's why we see the rate of transmission to this disease is higher, is rising always because people are not aware. And in most of the country, our leader pledged to take action, but it became a wish because we saw our leader in New York, in Geneva, to pledge about elimination. But when they're back to their country, the effective implementation of something like a backdoors or a mass campaign, as what Egypt did, it's become less. So it's very important to fight. Hepatitis is like one body two. It's like one stone, two birds. We fight hepatitis B, we fight liver cancer, but a test can also help us to reduce rate of transmission, because as WHO say, effective implementation of both those will reduce 95% of new infection and 65% of new deaths. But WHA needed to find the missing million to make sure that the people get tested. That's where our elimination goal by 2030 we can achieve. Thank you.
I just want to echo everything that Shaibu just said about it. And I think it's not only important, this testing is cancer prevention. And I think that message can't be said more loudly and said everywhere. And it's so important to make sure that people living with hepatitis are tested and diagnosed so they are linked to treatment, as it does really significantly reduce their risk of developing liver cancer later in life. WHA has been doing a lot of advocacy around liver cancer and hepatitis this past year, really up into the lead up to the high-level meeting on non-communicable diseases this past September. And I think, which was a really key momentous occasion, I just think, for the hepatitis community, just because the final draft of the political declaration included for the first time an endorsement by the UN that hepatitis testing is cancer prevention. And this is really, really significant because previously just the UN system had only really recognized hepatitis B vaccine as cancer prevention, but it now recognizes testing. And I think when Shaibu mentioned about the commitment from Tanzania and other governments, that really resonated with me. This high-level meeting is so important, not just for hepatitis, but cancer advocates, because it is a commitment from all governments to scale up testing and treatment as part of cancer prevention programs and provide the resources and for that. And I think it's a great tool for advocates to use to really move forward and to push for more testing and treatment access. And WHA will have a resource once the political declaration is adopted, hopefully in the next few weeks, with some messages and suggested things that you can do. But we've also got our white paper that can help really push as well, to help push and hold governments accountable to making these commitments and turning them into action, because no one should be dying from liver cancer caused by hepatitis. And the first step that we can do is make sure that everyone has access to testing. But yeah. Shaibu, go ahead, Dee, sorry.
Sorry, I'm just trying to type in the chat box to make sure everyone knows how to run the fireside chat. Sorry, I didn't, for being too excited, not giving enough time to let you know that you can unmute yourself now to really see it's okay for you to ask the question to join the fire chat. It's, again, you can challenge, you can ask the question that you're really looking for answer, or maybe something to comment. Yeah, it's time to unmute yourself. Oh, the floor is yours, dear participants. Anyone happy to unmute yourself? It really takes some time to, sorry?
No, go ahead, Dee.
Okay, I'll really take some time for you to consider what kind of question you want to ask. So, but I still got loads for me to, ask my dearest speakers here. But before that, I just wanted to echo to the Mohammed Zuba. You asked the question about the fourth result of the CLIA and ECLA. Maybe that is not 100% related to cancer, but we can do it at the end of the let's say the webinar to see what we can do for your your burning question. But when we come back to the liver cancer, so I'm gonna want to ask both of the speakers, what are some barriers to scaling up the hepatitis testing as liver cancer prevention?
Okay. Thank you very much, Dee. So far, the biggest barrier are awareness, access, and integration. Many people don't know that hepatitis causes cancer. That is a very big problem that we have. So they don't get tested. Testing is still now widely available.
So Alex, maybe you can.
Yeah, I can just jump in.
Frozen period.
Yeah, absolutely. I want to echo about the awareness point. WHA did a survey, I think 2 years ago, about overall global awareness of the link between hepatitis and liver cancer. And about half of respondents didn't know this, that hepatitis is the leading cause of liver cancer. And I think that's one of the really big barriers, and it's leading to misinformation. It's contributing to stigma and discrimination. And I think it's something that we can all do to try to address. And I think it's great that WHA has a great network of community-based organizations who are able to do that within their communities. And I think other barriers that may exist just in terms of scaling up testing as liver cancer prevention is, I think, what Shaibu was saying about the lack of political will, that lack of funding and resources that are just not available. And I think, as I said about the political declaration, I think it is a really big tool that we can use to really push for more political will to work for liver cancer and testing, and resources as well, because once it gets adopted, governments will commit to adding it, to scaling up resources. But I think we got Shaibu back, so if Shaibu wants to keep speaking.
Yeah, okay. So when the testing can be normalized as what we do in HIV, diabetes, and other diseases, will encourage people to get tested. But the problem that hepatitis are not integrated. And that's why even now, to the many countries, you may find that pregnant women get tested for HIV and syphilis, and they leave behind for the viral hepatitis. So awareness and integration. And when we talk about integration, we also talk about triple elimination. So hepatitis should be integrated into HIV department and STI to make it easy to be accessible. But another challenge that faces many services in African countries are not decentralized. You may find, for instance, here in Tanzania, the only place that you can access the good service about maybe testing and treatment is at Muhimbili. And many people, over 80% of entire population are residing into the rural area. So testing and treatment should be disseminated to the region, to the everywhere where people. This will help people from the community to seek for the testing, and when they get tested, they will be aware. So to fight for all of this challenge, awareness, access, and integration, we need a government will. If the government are not deciding to take serious with this issue, hepatitis will continue to take life of our people every day, because it's silent killer. It's not to speak. Many people are looking healthier, but indeed, many people die of liver cancer. As a head, I receive a lot of cases in social media where I do awareness that we have this problem, but we don't know how to start. And the challenge is you face the healthcare worker, you face a stigma. So even those who try to go to the healthcare setting, they face a stigma that hinder the health-taking behavior. So they opt other way to treat it traditionally, and it's risky because consumption of a local medicine, which we are not sure that is pure or itself, it increases the risk of liver cancer. But awareness, integration, and access will solve this challenge. Thank you.
I absolutely agree, and not just within HIV STI programs, it needs to be more broadly integrated into the cancer, the NCD programs, because that's what makes care. So it'll make care so much simpler and person-centered, and make it a lot easier to address challenges faced by hepatitis when it's one easier health approach.
Well, I just want to echo to Matthias. I think you make a very good point in this chat, saying that furthermore, testing aids in identifying the negative, let's say people living without hepatitis, individuals, and encourage vaccination in these individuals. I mean, this is a critical point that the many people in the policymaker, with or without political will miss, is that we don't have to not just focus on the people living with hepatitis, focus on, let's say the larger population of people without, viral hepatitis, because that really help us to know that in what area we should save our money with, not just spending money. Don't take a look at, blind using the blind side to take a look at where you're going to spend your money. Take a look at the side where you could save up your money. Thank you so much, Matthias. I think we are going to end the first fireside chat. Thank you so much, Alex and Shaibu, especially to you, Alex. You make a wonderful speech, and I love it so much. Even though that if I got time to talk about it a little bit more, but now we have to swap to another for our next fireside chat. Thank you so much.
Thank you.
And now we have to introduce Ronni Marks. So he's the director of the Hepatitis C Mentor and Support Group. And I would say that and also and I would say Tony is the person I heard a lot more. And also Ronni, we chat for a couple of times, but this is a very exciting fireside chat as well. So so this fireside chat is about the expanding the access to hepatitis testing in mental health setting. This is for me a total new area. I have no knowledge on this area. I'm thrilled. I'm all ears to listen to your discussion and sharing. So, but please talk about yourself a little bit before I ask the other question, please.
Okay, so I'm Ronni Marks. I'm the founder and director of the Hepatitis C Mentor and Support Group. We're an organization that covers nationwide education and supportive services linkage to care. I'm also a patient who cured from hepatitis C in 2014. Tony?
My name is Tony Martinez. I am the medical director of hepatology here at the University of Buffalo. And I run a clinic that we call La Bodega. And it's basically a co-localized program of hepatology and addiction medicine. And it interweaves HIV medicine, HIV prevention, mental health, behavioral health. And I've been treating Hep C since like the beginning times, since the interferon era. So I've been around this with a very specific patient population for about 25 years now.
When I heard about getting cured, the envious, 5 years really furious in my mind that it's good to get cured, but finger crossed, to cure for hepatitis B. But before that, everyone has to get tested. So I'm gonna have to give you the opening question to both of you. Why is addressing hepatitis, mental health, and stigma together important to scale up the access to hepatitis testing?
You want to start, Ronni?
Sure. While stigma is not a mental health disorder, it is a social problem that really harms mental health and well-being. And addressing hepatitis and mental health together overcomes stigma. It reduces psychological barriers and it builds trust. And trust, as we all know, is probably the most important thing that we have with our participants. And all of this is essential for scaling up access to testing and ensuring that people stay engaged in care.
Yeah, and I think, the stigma piece is one of the most underestimated and underrated problems that we have in terms of any viral hepatitis elimination, right? And when you think about what stigma means, it's the dehumanization of an individual, right? Based on their social identity or participation in a perceived negative or undesirable social category. I mean, that's the root of stigma. It's this dehumanization. So when we look at viral hepatitis in the mental health setting, a lot of the folks that we see in these priority patients, they have some comorbidity of some psychological diagnosis or some mental health diagnosis. And it's not always causative too, right? Maybe they were diagnosed with hepatitis B or C and that created anxiety. and depression, and that may cause self-stigma. We see that cycle a lot. There's stigma on the provider side. A lot of providers see a patient or a person who's coming in with hepatitis B or C. They have a bunch of medications on their med list and a bunch of things on the problem list: anxiety, depression, bipolar disorder, opiate use disorder, whatever the case may be. And that can trigger provider-based stigma. So there's a lot of roots to that. But I think that with point of care testing, with increased awareness around testing, especially point of care testing, though, it helps to overcome a lot of that stigma on both sides. For the patient, they don't necessarily have to get into all the risk factors. For the provider side as well, look, we do this testing on everybody. It's just routine. This is just normal testing. So I think that these types of newer tests that we have available go a long way to help to overcome that stigma in these settings.
Wow, thank you so much. I mean, it really helped me to open a new paradigm of thinking, because you have to understand that in Asia, everyone thinks that, no, sorry, not everyone, most of the people in my community do really think that it is my own fault to be a person living with hepatitis.
Yeah.
The self-stigma is so serious, and no one really think it is a wrongdoing. And when it comes down to going and have a dinner, lunch together with families, you have to shrink yourself, put it in a circle, saying that this is my territory, don't come into mine, otherwise you get into trouble. So that is the self-stigma is very important, and also discrimination as well. So in China, we have multiple suicides on an annual base, that people just committed suicide because of being discriminated, and people just ignore the part of hepatitis, especially B, saying that okay, he is having a problem mentally, it has nothing to do with the disease itself. And that is the really key question, that do we need to put hepatitis on the table to say these two things are linked together without getting testing, real knowledge, and understanding the transmission? You're not going anywhere to really to get the elimination. So because when it is everything hidden together, no one is going to come out. A lot of my friends are still in the same situation that would really love to do so. So thank you so much for helping me to open a new paradigm of thinking.
We have to equate viral hepatitis and viral diseases in general with other disease states, right? When
you have to integrate.
Yeah, and when folks get diagnosed with diabetes or hypertension, there's not this stigma that's associated with that. Those are just recognized as, oh, these are things that people get, right? And we're not there with viral disease, whether it's Hep B, Hep C, HIV, because in the background, lurking in the background, is this sort of sense of how you acquired it. Did you acquire it sexually or through blood products or injection drug use, right? So there's always this sort of like nasty thing behind it that we have to get past. It's just you were diagnosed with this thing. It's just like diabetes, hypertension, whatever. It's curable, it's manageable. In some cases, it's preventable. And that's kind of where the discussion needs to start to move to.
But we also have to, and I divide it into three categories. It's widely more than that, but self-stigma, community stigma, because much comes from the community, and provider stigma, which I really want to get into a little bit, because it's really I hear it all the time from patients that they were treated so badly, and it goes as far as language, cultural competency. I mean, these are all the things that we have to be aware of. And I've been doing groups for almost 25 years. And I started in the interferon era with support groups when everybody was angry and really having breakdowns, and through the cure. And to see the transformation in people psychologically and stigma-wise. It's astounding, but I still do have patients that come to me and say, I don't deserve this.
Yeah.
And I say, what do you mean you don't deserve this? Oh, well, I gave it to myself. I did this to myself. And those are the things we need to address.
I think, Ronnie, you make the point about the provider-based stigma, I think is one of the biggest
Yes,
problems that we have.
yes,
In how providers talk to people, how they interact with them, what does their body language look like? How
exactly.
do they welcome people when they come in? How do they speak? What words do they use? In my own clinic, we have three rules. Everyone goes by their first name. There's no titles. There's no white coats allowed. And every patient gets your cell phone number. It's just people helping people. We feed them, we clothe them, we tell them we love them. Because a lot of times these folks
That's
don't
right.
hear that, so at least we know when they come to us and when they're with us, we're breaking down that stigma. We're building out a circle of trust and love and compassion, and that circle pushes out, and it doesn't even allow these margins or barriers of stigma to exist. We're pushing that away. We're just destroying that. That's the goal of how we operate in our clinic. And I think that you know that provider-based piece is hugely important, because if you don't have that stigma, and if you can show folks that they're loved, that they're valued, that they're appreciated, then they can feel it in themselves, and you help them overcome some of that self-stigma as well.
True, true. Patricia just brought up something about sexual orientation, and you're 100% right. I work a lot in the LGBTQ community, and here's another stigma that they're coming in with, never mind all the rest that goes with it.
Yeah.
So, in the groups, my organization goes to other community organizations or syringe exchange programs or LGBT community, and we do groups around education, awareness, but we so much make people interact so that they understand their voice matters. We want to hear. And I always explain to them, I'm going to Washington or I'm going up to Albany. What is it you want me to say for you? How can I represent you well? And this is something that we all need to be doing as well, especially if we want to get some funding with the government. I don't know in the United States, but
I mean, look at what we're
yeah,
doing right now, right?
yeah,
You and I and some of the other folks on this webinar, we get the chance to speak and be out there, but at the
exactly.
at the end of the day, we're singing their song. We're speaking
Hmm.
to them.
And if I may, I said, I was talking to you about this the other day. We cannot overlook the people, boots on the ground, peers who are doing the work. They too are carrying all this weight and in some cases stigma. So
Yeah,
it's something we need to, it's a big picture.
yeah, absolutely.
I have another really burning question especially to Tony, that what can we do to ensure that everyone living with mental health conditions has access to hepatitis testing services? This is something I never, come across with any answers. Please let me know.
Yeah, I mean, this begins with a lot of advocacy, and it's advocacy with multiple stakeholders. So it has to be provider to provider. You have to speak that group's language, right? This is why this matters to you in the people that you're trying to serve. So when we approach mental health providers, we say, look, this is something that's highly prevalent among the people that you're seeing. You can help them by doing this. When we go to payers or we go to administration for institutions, we say, look, there's a lot of benefit of bringing this sort of testing into this group. We know that in people who have different mental health comorbidities, when we address your viral hepatitis, the mental health comorbidity improves. their quality of life improves. So there's all these downstream synergies that kind of come together when you introduce this this form of testing or these services into those settings. But you have to speak their language at the time that you're trying to implement it, you know, because it's very, if you just go in and say, hey, a lot of people have hepatitis, they're like, well, none of my people have it, you know, so you really have to like target it to,
Exactly.
this is
Right.
why this matters.
Yeah, true.
Right.
You know? Yeah.
Yeah.
No, it's so true.
I have to say that I would love to continue this conversation because fighting stigma and discrimination is all my life work. But shamefully that I never come across with the with the mental health issues. That is the biggest problem for the people working in the front line as a human rights defender like me. Never come across with the mental health and vice versa at the same time. So thank you so much for opening another paradigm of thinking for me. So thank you so much. Thank you so much.
Pleasure.
And I would love to introduce thank you, Tony. Thank you, Ronnie. I will introduce the third scenario, which is in the prison. So we are going to have the Julia Shihan. She's from the Women's Prison Peer Coordinator. She's a Women's Prison Peer Coordinator from the Hep C Trust. And also we're going to have my old friend of mine, Caroline Thomas. She's from the Peduli Hati Baksa. Every time I got it, not 100% right, but I'm trying everything I can. From the Peduli Hati Bangsa Foundation in Indonesia. So the floor is yours. Please introduce yourself a little bit, and then we can start with the fireside chat.
Julia, please.
Thank you, Caroline. Thank you for the introduction, Dee, and thank you to all the previous speakers. My name is Julia Shin, and I'm the Women's Prisons Manager for a charity called the Hepatitis C Trust. We are a patient-led organisation in the UK. I oversee our prison peer programme across the 12 female prisons in England. So thank you.
Hi everyone, my name is Caroline, and Dee, you mentioned it correctly, Peduli Hati Bangsa. So I am how do I say that? I am a caretaker of someone who is living with both hepatitis B and C, and the person had been on treatment since 2016, and now had been cured for hepatitis C and has a functional cure of hepatitis B. And then now we realize that not everyone has the same access to treatment, not everyone also has the same access to testing. So we then formed the foundation. This foundation is helping people to get information, the correct information about viral hepatitis, and also we are also providing access to testing and also treatment. We are also advocating for free testing and treatment in Indonesia. We're based in Indonesia, Jakarta.
Thank you both. I have to remind everyone as participant, please raise your hand if you have any question, because I have many, because this is another territory for me to explore. I have so many questions, but the general question that would be, can you let us know what is your work inside the prison?
Okay, shall I go?
Yes.
So I forgot to say that I self-cleared hepatitis B and also took DAA treatments for hepatitis C in 2017. So I'm now cured, and I think it's about lived experience. That's kind of what our whole role is about. So we train and empower people in prison to become peers so that they can support people in prison. We also deliver education, not only to people in prison, but to staff as well. It's so important that we deliver it to staff because we need to reduce stigma in all areas of prison life. We make sure that we're very visible in like well-being events, testing events, World Hepatitis Day events, any event that is being held in that prison, we will have a visible presence and engage people and use each engagement as like a harm reduction talk. And I think, you know, we have to keep talking about hepatitis C. My role at the moment is very focused on hepatitis C. It does have a wider impact on viral hepatitis as well. So we make sure people have had their vaccinations for Hep B. And I think that the more we talk about it, the more we reduce stigma and the more we normalize bloodborne viruses. We also deliver wing-based testing as well. So we will go, if a prison is struggling with maybe their offer and uptake rate, we will go onto the wings and do the testing ourselves. And in some of our prisons, we have trained people in prison to test people in prison. So that's just a little snapshot of the work that we do.
Thanks everyone, and thanks Lee for the opportunity. I will explain a little bit that in mid 2019, we led a project and we had a total of more than 16,000 inmates that were screened for hepatitis across all 7 prisons in Jakarta. We have 8 prisons in Jakarta, but we only screen for all 7 prisons in Jakarta because the last prison is a juvenile prison, so we have to have a separate consent for that. So we did not do the screening on that facility. And anyway, so the screening showed 6.1% anti-hepatitis C reactive, which is six times higher than the general population. We have a 1% of the hepatitis C prevalence in Indonesia. Mind you, Indonesia is a very large country. We are the 4th most populous country in the world. So we have at least 250 million people. So 1% of the 250 million means 2.5 million. But in the prison setting, the rate is much, much higher. It's 6%. And then out of the 6.1% that were reactive for the anti-HCV, we had confirmatory testing using PCR RNA, and 85% had active infection, meaning they have detected hepatitis C. And at that time, we also urged the government to provide treatment. So around 62% were initiated on the treatment. It was a major achievement because during that time, COVID-19 restriction had started. So the project drove a very important policy change. By the end of the project, the prison health budget had increased, and the Indonesian National Hepatitis Control Plan had included inmates as the priority group in the plan. So more recently in 2024, it was in general prison, including the women prison. But more recently in 2024, we had International Testing Week. But when we announced that we are going to have an International Testing Week, many of the community health center offered that they would like to do another screening. So last year, we finally had HIV, hepatitis B, hepatitis C, syphilis, and also human papillomavirus screening. So it was a huge one. Look, everybody wants to contribute. And also the doctors from the community health center are also offering to check for the high hypertension, diabetes, even eye test. So it was an hepatitis testing week, but it was more on a health day for the health screening day for the women in prison. Yes, the key findings is that we have 7 HIV positive cases. All have previously diagnosed and were already on ART. No new infections detected. We have found 7 hepatitis B cases. All have been referred for monitoring and also treatment if they needed treatment. Everything is provided for free. We have 9 hepatitis C cases. 3 had previously treated with DAA and has been cured. 6 has now on treatment. We have also 15 syphilis case and 1 HPV DNA positive case, which were, but there are no findings that indicates cancer lesion. So yeah.
I have another side question that totally, fascinating. Let's not say fascinating. Very, I've been asked for many times. Prison is always a place of, black box that the some of our colleagues in different countries are always resource limited to do something in the prison. So especially to Julia and Caroline, can you share some of your success and key learnings that to the other organization that especially with the resource limited scenario? So maybe you can tell us when you are short of some of the resources, how are you going to break the silo, break the barrier to make things happen? Julia.
So, I really acknowledge that the UK, we have resources and hepatitis C elimination is very well funded. But in terms of maintaining and when that funding isn't there anymore, we decided to look a little bit further and look at where there was no hepatitis C staff involvement, and could prisoners test prisoners, which is something that a country that would have less resources could definitely do, as long as they've got the access to testing. So in one of our prisons, it's a sentence prison. It's not a remand prison. It doesn't have a huge turnover, so they use DBST testing, which goes off to a lab. And that was a perfect place to use people in prison, to test people in prison, because they, there would be no confidentiality breaches. The people testing wouldn't be privy to results. And, it's that trust thing. And one of the previous, Ronni, I think, spoke about trust. It's people in prison trust each other a little bit
true.
than they might trust staff because of their previous experiences. So it's really working there, and actually it's hugely increased uptake of testing. So that's definitely something that could be used in maybe lower income countries.
Caroline?
Yeah, I also agree with the use of the POC, if there are any POC to be used in the near future, because it is difficult for a general population to go to a hospital, or maybe they don't have time, they don't have the effort, they don't know, they don't have the information, they don't want to go, just of the stigma and discrimination maybe. But for people in prison, bringing the point of care machine will be very beneficial. And there are also some in the pipeline, there are some multiplex POC, so it means that you can test more than one disease in one using a very small machine. So we hope to see that in the future. Based on our experience, we had made mistakes in the planning, of course, but it is, we can use it as a learning.
Oops. Are you still here? But
it has to use the serum, but to use a serum, we need to have a separate machine.
Sorry, for cutting you off a little bit early, because we don't have enough time to get it going with these.
To turn.
Sorry.
The machine.
So, yeah, thank you so much, Julia and Caroline. That really helped us to understand more about this black box. We never got a chance to work anything inside the prison, even though we work with the officers outside the prison. But nonetheless, it's okay to do so or not. but it depends on how people reflect, giving it a very cold shares of data. What have we done through these officers in the prison? But with your encouragement, that because I totally agree with you, the peer power matters a lot. So thank you so much for bringing up these critical issues in the prison. Thank you so much. Thank you, Caroline. Thank you, Julia.
Thank you.
So today that we have 3 wonderful fireside chats. I don't think the time is totally enough. I hope that in the near future we can explore different topics a little bit more. But still, with the time limitation, I can still learn that the especially for Alex, you mentioned that it's an equation. Testing can stop liver cancer, can reduce liver cancer. Simple as that. I don't have next time. I don't have to explain to the policymakers or maybe to the my friends. Say, okay, you have to do the testing and stop the viral blah blah blah. Simple as that. That could really help you to reduce the risk of the liver cancer, and also learn from the from Ronni and Tony that the it's a mind-blowing let's say paradigm thinking for me to say that it's a mental health problem. If you keep it to yourself, it's at the end of the day, it's not just about the self-stigmatization. It's not just about being discriminated and fight for your rights. At the end of the day, you just totally ignore the fact that you're in serious trouble of pulling yourself into the abyss of mental health. So address the mental health issues is probably the best way to reflect the discrimination and statement. And also learn from Caroline and Julia saying that without peer can also one thing to help you to get an easier access to the in the prison work in terms of testing, and also it's a good way to reduce your cost when you're facing the issue of the limited resources. So yeah, thank you so much for your sharing. Last but not least, I, as the president-elect, want to tell you guys that I also make a very funny video today to try to engage with the testing week. And also my team back in China have done some, I would say, easy and fun way to promote the testing for viral hepatitis within like 30 seconds. So I'm going to end this conversation with these 2 lovely video that I would really want to show you. And please also, after the video, complete a short survey about the webinar, which is going to put in the chat now. So again, thank you so much. Go get tested and go get everyone else tested. So it's the testing week started. What we should do is to engage everyone. Let's go get tested. Whatever. Get tested. Get tested. Get tested. Get tested. Here we are. Get tested. Get tested. Sorry. Last but not least, want to echo to respond to the question of Muhammad Zuba. You mentioned getting the false positive and false negative result on the CLIA and this ECLIA. I don't think there's any good way to turn around the facts that all the facts are the false result. That just go for the DBS, make a good case study to tell people that it's even easier to do the POC rather than doing a lot of expensive machine. But at the end of the day, you can also do the next testing to really verify your result. So I'm not sure I give you the good answer. Please, engage with the alliance on with the difficulties, your issues, and help us understand your situation. We are here to help. Thank you so much. Okay, bye. Thank you all the speakers.